When people are considering implants, there's a number of pros and cons. Specifically for the advantages is it's typically a more simple surgery than some of our alternatives. If a tissue expander has been placed, then we go back through that same mastectomy incision, we remove the tissue expander and the implant goes right in. That can be done in potentially an hour. So it's a relatively quick surgery, minimal downtime in the sense of pain and recovery. And the implants can look great. It can give a very youthful breast. That being said, there are of course some negatives. So for an implant, it feels different than a natural breast. It feels like a silicone implant. While some people like that, it can be a little bit firmer and it can be a little bit uncomfortable for some patients. Probably the biggest negative related to implants is, unfortunately, we call them a permanent implant, but there's really no such thing as a permanent implant. So at some point, these implants will fail. It's not a matter of if, it's a matter of when. We typically quote a 10 to 12 year survival for these implants. So for a lot of patients, and as we start diagnosing earlier and earlier cancers in younger patients with genetics and such, these patients are looking at surgeries later in life regarding their breast and their reconstruction. So we do have to think about that.
So the pros for implants is they're shorter surgery. Patients have lots of choices these days from different implant companies in different shapes and sizes, and implants have come quite a long ways over decades. They're safe. They have relatively longer lives now in terms of, implants and foreign bodies. So patients can choose a shape, a size, a volume, a projection, and lots of dimensions. But it has to work with their body. It has to work with their chest. It works with their clothing, and so those are one of the biggest advantages. The disadvantage is that there's still foreign bodies. Things like infection and implant failures do exist, and as I say, that putting a foreign body in a human, just like a hip replacement or a heart valve, it's not going to last forever, and there may be a likely need for other surgeries.